So what is the definition of hypoglycemia? When do you call a patient to be hypoglycemic? Normal blood glucose range in the fasting state is between 70 to 110 or 100. In the postprandial state, it may be anywhere between 100 to 140. If the blood glucose falls below 60 milligrams %, then it is mild hypoglycemia. This causes the adrenergic symptoms, which we will see a little later. The second level is the moderate hypoglycemia, wherein the blood glucose falls further down to around less than 50 milligrams, and this produces cognitive symptoms or neuroglycopenic symptoms. The brain suffers because of lack of glucose, and certain symptoms are produced, which we will see in the subsequent slides. The severe form of hypoglycemia is when the blood glucose level is 40 milligrams or less. That may lead to confusion and unconsciousness. Remember, 7% of people arriving into an emergency room with decreased mental status will have hypoglycemia. So if a person is brought into an emergency room with unconsciousness or semi-consciousness, the chances of he or she having hypoglycemia is around 7%, and we have to think of this in every patient who is brought in such a state to the emergency room. So mild hypoglycemia, blood glucose less than 60 milligrams, moderate hypoglycemia, blood glucose less than 50 milligrams, severe hypoglycemia less than 40 milligrams. Please remember this golden rule of hypoglycemia. Hypoglycemia must be considered in any patient with mental confusion, altered consciousness or a seizure. This is an imperative rule that all of us should follow, so that a very striking and treatable condition should not be missed. If we diagnose hypoglycemia, we will get the patient up in another half an hour or 15 minutes time. If we miss to think hypoglycemia, then we may lose the patient permanently because of irreparable brain damage and fatality. It is probably the most common endocrine emergency and frequently occurs in patients receiving either insulin or oral hypoglycemic agents and who are under tight blood glucose control or rigorous treatment. So if the history of being a diabetic and on insulin or on oral drugs and the patient is unconscious, sure, we are dealing probably with hypoglycemia. This rule must be kept in mind. So what could cause hypoglycemia? We have seen the glucose levels are in a delicate balance with the hormones and the counter-regulatory hormones, insulin and its counter-regulatory hormones working very synergistically with one another and then keeping in check the blood sugar level. But if there is an imbalance, hypoglycemia can result. How the imbalance can occur? Increase in the rate of appearance of glucose, RA, that is ingestion of food, excess of glucagon, epinephrine and cortisol raise the blood glucose. On the contrary, decrease in the blood glucose or rate of disappearance of blood glucose increasing, that means blood glucose comes down. Insulin, oral hypoglycemic agents, other drugs, physical exercise or strenuous activity, these will bring down the blood glucose, whereas these are the ones which tries to maintain the blood glucose or increase the blood glucose. So there is a delicate balance between the forces which tries to remove the glucose from the system and the forces which try to keep the glucose up in the system.